All right, hello everybody. My name is Jill Barr and I serve as the Outreach Navigator for Clay County Behavioral Health LINC, or the local initiative for networking and collaboration. A couple of housekeeping notes. The restrooms are off to the left here. On the chairs, you'll find informational resources. These are yours to take home and to review on your own. We have an hour here together tonight, so the format will be our speakers will individually address the audience and we will hold all questions until the end of the presentations. The slides that you'll be seeing in just a little bit will contain the name of our speakers and the agencies and the organizations that they represent, as well as some upcoming opportunities to learn more and some actionable tips. So with that, let's begin. Welcome to Stronger Together, a community provider panel. Tonight you're going to meet with local providers and learn how to access the services and the resources that they provide. We want to thank you for being proactive in making the time to learn. Why? Current statistics say that 1 in 5 people will experience a behavioral health challenge, and a majority of those will not seek help because they're hesitant because they don't know where to go, because they fear judgment, or there's an expectation that they should just pull themselves up by their bootstraps. We realize while there is no wrong door when it comes to providing behavioral health support, the number of options can often be overwhelming. So we're here to share with you tonight. So with that, I will have our first speaker.
Is that me? All right. Well, my name is Sergio Clucker Billups. I am a psychiatrist and the medical director of Spencer Behavioral Health. I got my cheat sheet here. So we have several services at the Spencer Hospital, and that's just right here in town. It's 1200 First Avenue East here in Spencer. We have an inpatient unit that I work at, and then also Matt Baltus, who's a nurse practitioner, also works there with me. And that's about a 15-bed unit, dealing with just more severe presentations, I would say, more acute presentations of mental illness, suicidal ideation, acute psychosis, mania, things of that nature. The best way to access that service would be actually to go to the emergency department, because if you're having an emergency, that's where you should go. And then they would refer to us. As far as types of insurances, that's not an issue. We take anybody in their time of crisis, and we serve everyone, from people who look like they have it all together on the outside to people who chronically struggle with mental illness. And so mental illness doesn't discriminate, so we take everyone in the inpatient unit. At Spencer Hospital, we also have an outpatient clinic. Matt Baltus works half days at that clinic, and so does Mark Hepworth, who's another nurse practitioner. And they're both great. And the best way to be referred to that clinic would be either through your primary care provider or by just calling directly, and that phone number would be 712-264-3515. Insurance there, will work with you as well. I don't think anyone has ever been turned away because of the insurance issues. So we also have a chemical dependency counselor who works both outpatient and inpatient. That person's name is Casey Fear, and so she has her own chemical dependency clinic, outpatient, but also sees patients on the inpatient psych unit and on the consultation service. And then we're gonna be starting with a therapist who's gonna do some work both on inpatient and outpatient as well, named Rochelle, and that'll be in August. Those services will be available. So yeah, we see all kinds of people, have a variety of services, and we just really encourage if you need help to just reach out, because we're there for a reason, so use it if you need it.
My name is Ann Peters, and I am one of the owners at Northwest Iowa Counseling here in Spencer, and we are a team of 9 therapists. And so our team consists of myself and the other co-owner, who is Amy Onwler, and then our other therapists are Deb Estes, Kristen Triplett, Melissa Muggy, and Heather Howell, Ashley Reineke Spencer, Tanner Carlson, and Hannah Pfeiffer. Right now we are located in our temporary office space, which is at 1501 35th Avenue West, out in the industrial park in the Generations by IGL building. And as of July 1st, in a few weeks, we will be moving to our permanent address at 920 South Grand Avenue on the south side of town, next to the Grand Auto down there. And so that will be a great space for us to be able to serve our community. We also have a location in Esterville, and we serve via telehealth as well. We serve all ages. We have clinicians that serve the youngest of our population, our young children, all the way through the lifespan, and the elderly population. So we serve all ages in between for individual therapy, and then we also offer couples therapy, family therapy, and we are offering some group therapy as well this summer. We accept all major insurance companies, so Blue Cross Blue Shield, Medicare, Medicaid, United Health Partners, Aetna, and Avera, to name some of our most popular ones. We also accept the majority of the employee assistance programs for a lot of the area's businesses that offer those. We accept those as well. And we do offer a sliding fee scale to those who do not have insurance coverage. So we do not turn away clients if they do not have the ability to pay for their services. How to access our services would be to call our office at 712-262-6111 or visit our website at nwiac.com, and then on our website we have an area where you can request some more information, and we are typically in touch within 1 to 2 days on all of those requests.
So my name is Amy Davis. I am with Lutheran Services in Iowa. It's a statewide nonprofit agency. So I've been with the agency for about 22 years now. We have an office location here in Spencer. You guys may have known that we were in the kind of the old hotel for about 3 or 4 years, and then we moved to 20 West 4th Street, so that's where our current location is. We offer statewide, we offer a multitude of services. We have various different departments, like services for people with disabilities, immigrant refugee services, mental health programs, early childhood services, foster care and adoption, which is located in the western Iowa, and then supported apartment living, which is over in the Waverly area. But primarily in Spencer, we offer therapy services, behavioral health intervention service. We have some in-school type service that we provide for community adolescent pregnancy prevention, as well as personal responsible education program. We have 41 therapists across the state of Iowa. So here locally in Spencer, we have 4 that are in person that can do telehealth across the state, ranging from, as Ann said, early childhood, young kids. We do play therapy, all the way up through the lifespan to the elderly. We have therapists that are trained across a multitude of different types of modalities, and that could be EMDR, progressive counting, play therapy, TheraPlay, CBT, DBT, and a lot of others. We accept all kinds of insurance. We also do not turn people away. We look for grant funding to help pay for services. Specifically in Clay County, we do have grant funding to help flood victims. So if they want to access therapy services, we do help them with some co-pays or payments if they're unable to make the payment. If you do want to schedule, you can go to www.lsiowa.org, go to mental health services, and then go to therapy services. There's an intake form that you guys can just fill out, pretty simple. It gets sent straight to central intake. So we don't take the intakes locally, those are through a 188 number, so it may seem kind of weird when they call you back, it's an 800 number, but it is our central intake. They're located out of Waverly. So they then call back, they'll run insurance, get everything collected, start the paperwork, and we have like an app system basically where we send you paperwork that you can fill out and send back virtually. We also have, you can call in, and that's 1-888-457-4692. They just ask that you have your insurance card ready, and they'll just ask a few simple questions, and that will get you straight to the clinical services, therapy, and VHIS. Thank you.
Okay, so I should probably stand, but but we're gonna go to sitting down. So I'm Rebecca McCracken. I am with Season Center for Behavioral Health. We are located actually right behind the hospital in our Spencer main location. Autumn Center is still working through remodeling and working through the flood restoration because it was impacted. So our Children's Center will be open again, but it's just not there yet. We have office locations across multiple counties of the area. We're in Lyon County, Sioux County, Osceola, O'Brien, Dickinson, Clay, Emmett, Palo Alto, BV, and then down in Carroll. We also provide services in school districts, not Clay County school districts or Spencer school districts, but we do provide therapy and skill building in numerous schools. So we provide a multitude of services. So we provide general mental health outpatient therapy, substance use, as well as co-occurring therapy. And then we provide also psychiatric services and medication management. And then we have what's called the care team. And part of the care team is really just this big wraparound services that include peer support, case management, care coordination, nursing support, as well as a level of family support. And so essentially we have individuals who are bachelor level that will and can help out at anything needed for case management, connecting to resources, being out and about in the community to support families and individuals, and working through the different struggles and connection to resources, whether that be housing, food, hospitals, any of those kind of pieces. We work with families and individuals and kiddos in their home, providing skill development and supportive services. And that is with a primary population of foster, adoptive, and kinship care individuals and families, as well as kids who are at risk for system involvement. Otherwise, our services are, again, we are a no, we'll accept anybody. We accept any insurances. Not all of our providers are able to see every insurance, but for the most part, we are able to get people cooked up with whoever is needed. We do have sliding fee, so similar to others talking about sliding fee, we'll work with you if you can't afford. Our access comes from, you can call us at 712-262-2922, or you can just come into our locations. We provide services and we get people started just by walking in. And I think that's all I have. So. Crisis. Oh, I forgot to talk about crisis. Oh. Okay, sorry. I'm not standing behind you. I don't want to go back to the table. So one of the other really big services that I totally blanked on was our crisis services. So we have both what's called mobile crisis as well as residential services. And then we have a talk line. So if you're having a struggle, you can call our crisis line and the cards are dispersed on the chairs. And they'll be able to talk to you. And then if you need somebody who's there, even more support, we have what's called a mobile team. And so they'll actually go out to you and meet with you and talk with you. And then if the need is bigger, but not quite needing to go to the ER or be hospitalized, but still pretty big, that you can come into our unit to be able to get a level of stabilization. And so all of those things work through our mobile crisis team. And the number for that is going to be, you can either start going through 988, and then you get funneled to us to be able to go that way. Otherwise, our toll-free number is 844-345-4569. Okay, I think I got her now.
My name is Nicholas Hanges, and I'm speaking on behalf of the Spencer Ministerial, and we are just a group of local pastors, about 15 churches represented. We meet every month, 9 months out of the year, and we're like a bridge from the providers and the local organizations to the local church. We believe in caring for people physically, mentally, and spiritually, so we're providing spiritual care, and we work with agencies. We help in finding housing, finding counseling and support from these incredible professionals that are gathered around me. We have what is called the Multi-Church Assistance Fund, so we work with Upper Des Moines and provide housing for people in urgent situations, and we also have programs in many of our churches that tie into mental health, Celebrate Recovery, and Grief Share, things like that. So we're just honored to work with agencies and partners, and we care about the mental health and the spiritual health and the physical health of people in our community, and we are happy to help. That's it.
So there was mention of crisis earlier, and we did have a speaker tonight that just sent me a text message and has an individual that they are going to help. So I'm going to read his information on his behalf tonight, and then a few more of our agencies. So this would be for child glow therapy, and the provider's name is Michael Pop, LMHC. His address is 20 West 6th Street, Suite 102, here in Spencer, Iowa. He serves ages 5 through 25. And for insurances, he has listed Medicaid, Health Partners, Wellmark, Blue Cross Blue Shield, WellPoint, Molina, Aetna, Iowa Total Care, HSA, a health savings account, individual payment plans, and TRICARE. To access Michael's services, he would ask that you would call him at 712-318-1882. A few others that we have here tonight, and I'm going to sit for this part. First would be Rosecrans Jackson Centers. Rosecrans Jackson Centers provides adolescents and adults with individualized addiction treatment and prepares them and their families for life and recovery. Treatment is grounded in the 12-step principles and focuses on helping them develop essential tools and positive, healthy relationships. The services that are offered at the Spencer location include substance use evaluations, DUI and OWI evaluations, jail evaluations, outpatient individual sessions, peer recovery services, prevention, gambling, problem gambling services, extended outpatient groups, facilitation of residential services for those that are needing inpatient treatment, which their inpatient is located in Sioux City, and referrals as appropriate for mental health and medical services. They are located at 1713 McNaughton Way in Spencer, and their phone number is 712-584-2030. To To access services, please contact them during their business hours, Monday through Friday, and speak with the staff to schedule an appointment. Rosecrans Jackson Centers is dedicated to helping people afford excellent care at a reasonable cost. Their staff is going to explain their financial policies before you get started, and then work with you to verify your insurance benefits. Rosecrans Jackson Center serves all patients regardless of ability to pay. Discounts for essential services are offered based on family size and income. Next provider we have is Grit Therapy. Grit Therapy specializes in helping first responders and youth face life's toughest challenges with resilience and strength. Owner provider Meredith Frazier is a licensed independent social worker and a certified first responder counselor. Compassionate, tailored care is provided for those that serve on the front lines and also young individuals who need support during critical moments. Grit Therapy is affiliated with the First Responders Foundation. Grit Therapy's address is 1204 West 18th Street, and Meredith is available during business hours Monday through Friday. She serves individuals from 12 through age 65 and accepts most major insurances. To access Grit Therapy, you're asked to reach out first by phone or text at 712-363-8866 or email grittherapy24@gmail.com. Intake paperwork will then be sent, and then once that paperwork is done and completed and returned, the individual will be contacted to set up an appointment. The next provider we have is Community Health Center in Spencer. Community Health Center of Spencer is a federally qualified health center and serves all people, whether payment for services would be made under Medicare, Medicaid, or CHIP. Care is also provided regardless of the person's race, color, sex, national origin, disability, religion, or age. No one will be denied access to services due to the inability to pay, and they have a discounted sliding fee schedule available based on family size and their income. They offer medical, dental, and behavioral health services for patients of all ages and in multiple languages. They also have staff who assist patients in finding community support services and a financial advocate who helps with eligibility and enrollment assistance as well as a sliding fee scale. Community Health Center in Spencer is located at 223 West 7th Street in Spencer. To access their services, just stop in or give them a call during business hours, Monday through Friday. There are no referrals needed and no eligibility requirements. Ashley Anderson is their behavioral health provider, a psychiatric mental health nurse practitioner, offering evaluation, diagnosis, and medication management. Taylor and Christine are their patient and community navigators to support with financial and insurance concerns, and then non-medical concerns such as housing, food, and transportation. Julie Beeler, advanced registered nurse practitioner and their medical director, offers general primary care for all ages, including acute care, preventative, and chronic care. And comprehensive dental provided there includes, but not limited to, exams, cleaning, sealants, x-rays, extractions, filling, crowns, and more.
I'm gonna stand. Good evening. My name is Ayan Thomas, and I am with NAMI. NAMI stands for National Alliance on Mental Illness, and my position is an outreach specialist, and it became available when the flood happened. So pretty much what I do is just walk alongside people and make sure that they get the resources that they need. So what does NAMI actually do? NAMI provides advocacy. So also the advocacy part, NAMI works at the local, at the state, and the national level to push for better health, better mental health and policies, which actually just happened on April 2nd. That was NAMI Day on the Hill, which was actually fantastic. We also push for protection of patient rights and access to services like housing, treatment, and education. Speaking of education, you can go on to NAMI.org, and there is a plethora of resources there for you with whatever that you are struggling with or your family member might be struggling with. There's also support groups, but I'm going to come back to that in a minute. The educational part too, there's family to family. You can find out more about that on our website, peer to peer. And then there's this big thing called End is really cool because it helps students and families and also school staff to raise mental health awareness. And I think that is so needed right now, and just to normalize talking about mental health. All the programs are free, and they're taught by trained and those who have lived experiences as well, so they can relate. There is a NAMI online helpline, so you can go on our website as well and see that you can call at any time. It's for teens, adults, for anyone. There's also community engagement awareness. So I've partnered with LSI and LINC, and there's going to be upcoming events this summer. So please keep an ear out, and those will be fun things to kind of just engage families and bring them together and just kind of do something together outside. So back to the support groups. We have started a support group here in Spencer. We meet every fourth Tuesday of the month at the library at 6 to 7:30. And it's great. Some people think, oh, I don't really need that, but if you just want to connect with people and you're struggling and you don't have a therapist or somebody that you might go and talk to, come check us out. Sometimes it's not really just for you, but maybe what you might have to offer to somebody else in a group. So if you have a lived experience, you might be able to actually walk alongside somebody in that group and make a connection and help somebody. So that's been great. And I love the support groups because these groups offer a safe, non-judgmental space to share experiences and to also get support. If you would like to contact me, you can reach me by email, my email is nwoutreach@namiiowa.org, or you can contact me at 712-339-4424 with extension 103. And I just want to remind everyone that you are not alone. You are absolutely not alone. And please, if you're here or watching, reach out to any of the providers that you have heard from tonight. I know that any of us would be more than happy to walk alongside of you or point you in the right direction. Thank you.
Okay, well, that concludes the presenters that we have here tonight. I do want to say a big thank you to our planning committee. Many of you are sitting in this room here tonight. We've had a small group that has been working together to work on different ways of how can we help educate the public, how can we help get the message out, and so I really appreciate them making time in their day to be able to work on some of these projects together and bring these type of things to you so that people are aware of what is out there, because being proactive is really the key. You know, we mentioned crisis earlier. Can we help people before they get to that point? And you know, knowledge is power, and so the more that we learn about what services and resources are available, the better we're going to be and the stronger we're going to be as a community. So thank you all for joining us tonight. And now at this point in time, if anybody has questions, we actually have plenty of time that we can have as much of a discussion as people would want to. So I will open the floor up to anybody that has questions at this point.